So we've talked about a lot, just kind of easing our way into this is the main, the meat and the potatoes. How do we manage osteoarthritis non-surgically, right? Medical management of osteoarthritis. The first thing that I'd like to point out is that the goal differs for everybody. Everybody is an individual and the therapy is different for all of us. It depends on what your goals are. But the goal is to get you to living your best life, hopefully, right? Um, the other thing to note is that it's a team effort. It's not just one person. Usually it's like multi-specialty management. Oftentimes people present to their primary doctors first. They might end up in my office because we're not really sure if there's another kind of arthritis at play, for example. Physical therapy, occupational therapy. I love physical and occupational therapy. It's a very important part of management. Physiatrists, I feel like, are underutilized, but they're very, very important in the management of just kind of getting back to functioning when you've had pain for a long time. Nutrition, we talked about the mental health impact, so thinking about counselors, social workers, talk therapy. Sometimes pain management physicians play a role in the management. Podiatrists, especially if it's like the foot and ankle area that has osteoarthritis. And I put orthopedic surgery here because they also help. Sometimes we're talking about non-surgical management though, so that's why they're at the bottom of the list, right? Because that's like the end of everything else. Okay, so whenever a patient comes to see me with joint pain, the first thing I do is get a story. It's really important. Again, trying to figure out which arthritis it is. Is there multiple, more than one? And a lot of it boils down to the story. The story sounds different for different kinds of arthritis. And then usually we get blood work to figure out, again, what kind of arthritis might be playing a role, but also because blood work helps determine treatment, like we'll talk about in a little bit. X-rays also are really important because they can tell us part of the story. And then I like to use the ultrasound a lot because it's a point of care tool that you can use in the clinic, and it can help provide a diagnosis really, or help support your diagnosis. And then sometimes, especially for large joints like the knee that might have fluid in it, we take it out. One, it helps you feel better. But two, we can analyze the fluid and see what's going on. That can also be helpful and help diagnose. So first things first, lifestyle changes that we can make as far as management goes. Diet is a big change. The Mediterranean diet just sums up what I recommend as far as portion sizes and things that are important. So fresh fruits, vegetables, fish, white meat, things like that, because there is a role for diet and inflammation. There's some impact with the kind of diet that people eat and how it can affect inflammation. But also a Mediterranean diet is all around great. It's good for heart health, brain health. It helps with lowering sugars. So there's no disadvantage really to a Mediterranean diet. And it kind of goes hand in hand with weight. So Mediterranean diet can also aid with some of that weight loss that we're trying to achieve. And so again, all the way recommend a Mediterranean diet. Physical activity sounds counterintuitive because, I'm hurting. Why do I want to be active? But we talked about the muscle working with the joint. So physical activity, the goals are to strengthen the muscles so that they can support the joint better. But also we want to work on our balance and our gait, especially with lower arthritis of the lower part of the body. So exercises to strengthen the knee joints, the muscles around the knees, really important because it can also help with fall prevention too. I usually recommend water exercise. It's a great way to get everything done with low impact to the joints, and it really gives you a good workout. So water exercise is really good. Cycling is a good thing, like indoor cycling even, taking walks, agility type exercises, but really important to maintain good form while exercising because we don't want to aggravate and cause further injuries. Other than maintaining good form, it's important to stretch before and after exercises. It's also important to wear good shoes, so good shoe support, because all of that can then feed into causing more injury, right? And so this is where physical therapy comes in because they supervise exercises. And so I recommend physical therapy to really everybody, regardless of the kind of arthritis. I think they're a wonderful tool and I utilize them a lot. They work with you, again, to individualize that treatment, to tailor it to suit your needs and your goals, right? They work with you to provide assistive devices, like we'll talk about, that are fitted to the person. So I recommend occupational therapy and I can't recommend it enough. Physical and occupational. The big difference is occupational therapy kind of focuses on the arms. So people sometimes will have reduced strength in their hands, might have trouble with opening jars, for example. That's where occupational therapy really comes in. They can help audit your lifestyle, audit your home, and come up with things, devices that can help, custom made for you. And so I can't say enough about physical and occupational therapy. So assistive devices are really important. In the management of osteoarthritis. So for knee osteoarthritis specifically, wearing a brace, because a lot of times people feel unstable, their knee feels like it's going to give out. And that knee, the brace provides support. Sometimes depending on what kind of arthritis, especially with the hand, that's where occupational therapy would come in, creating like a custom splint that might help with, again, targeted to the problem. Sometimes walking devices might be needed, right? So like a cane, short term, because we don't want to fall. We talked about, some of the things that might happen mental wise, but also falling can increase the risk of things like fractures, for example, like a hip fracture. And so sometimes while we're trying to get that strength built up, we would recommend like a walker or a cane, depending on how weak. Is it one-sided? Is it both sides? That's kind of where we decide. And again, physical therapy can help with some of that.